And welcome back. And like we mentioned before the break, Dr. Chrissy Alexander from FSU's College of Medicine is here to answer more of our COVID-related questions.
All right, Dr. Alexander joining us over the phone today. How are you doing? And thanks so much.
Oh, doing great. Thank you.
All right. Well, with school starting on Monday for many in our area, what's some advice that you'd like to give to parents?
So some great advice to think about is, first off, just talk to your child about how it might look different this year in school, with desks being maybe farther apart or teachers maintaining physical distance, maybe even the possibility of staying in the classroom for lunch, things like that, just getting them prepared mentally for how school might look. Explaining the importance of wearing a mask and why we wear masks, to keep them safe, to keep their teachers safe, to keep their friends safe, things like that, so they have an understanding as to why the masks are so important. And like we said in an earlier segment, having them pick out their own mask so that they will want to wear it and practice putting it on without touching the cloth that covers the face. Things like that will be very, very helpful as well. You can label your child's cloth face mask or other face mask with a permanent marker so it doesn't get confused with those of other children, for example. Also, like letting them put it on their stuffed animals or wearing it during screen time so they just get used to wearing it before they get there. If they're not used to it already, they'll have to be wearing it for longer periods of time, things like that. Send them in with the resealable bag so that when they take it off to eat lunch, they can put it in their bag and then take it back out and show them how to do that. There are just so many things that parents can do. And of course, if your child is sick, keep them at home. Know who to contact at the school to talk about that. Having somebody's name, either a school nurse or administrator as the school contact person, is helpful as well in terms of preparation for the upcoming year. And then last but not least, just having a backup plan in case a kid does get sick or the school has to close down for exposure reasons, things like that. Just having a backup plan in place if needed.
All right, so lots of good advice there. And again, we put these segments online, so if you missed any of that, you'll be able to watch it there again to jot down some notes. Dr. Alexander, in light of the positive cases, or case I should say, tied to a fraternity party last weekend at FSU, and the outbreak of cases that we've seen on campuses really nationwide, what else could the medical community or these universities, even parents, do to try to stress to this demographic how important it is to follow protocols that are in place?
That's a great question as well. President Thrasher sent out a very strong email earlier this week explaining the importance and the consequences should students be seen not abiding by social distancing rules, face covering rules, things of that nature, and explaining those consequences as disciplinary probation, administrative action, things like that, just helping the students understand that there will be actions taking place to keep people safe. And then, of course, just explaining, we know that you want to be here and you guys want to be back at school with your classmates and be away at school and things like that. And in order for it to stay that way, we all have to stay safe. We have to be abiding by the school's guidelines. As a medical community, just getting that word out. I know at the FSU College of Medicine, we talk about it a lot with our students. They, of course, understand the consequences of COVID-19 in a different way because they are in medical school. But just those outward consequences of being able to stay in school without having to go remote with remote learning.
Yeah, and Dr. Alexander, case numbers across the state as a whole have been on a downward trend recently, but how is Leon County looking?
Leon County is looking really pretty good. Our numbers have dropped again. I mean, it's a day-to-day thing, but they've gone down almost 20 since yesterday. So they've stayed pretty much in the right range over time. They haven't shot up like they had earlier in the month. And as far as hospitalizations go, TMH's hospitalization rate is down again. So they're down to 25 positive hospitalization cases at the moment, which is great, because the last time we talked, I believe the number was 31. So the numbers are looking pretty good, and we're hoping that it's because people are taking the appropriate precautions.
The FDA approving a new test for COVID-19. Can you tell us some more about that, and are any of those tests available here?
Yes, this is a really exciting opportunity. It's an antigen test, which antigen tests have been available already, but this one is different because it's fast and it's easier to analyze. So instead of needing fancy equipment to analyze it, it's almost like a pregnancy test where you just put a droplet onto the test with a developer, and within 15 minutes, you either have 2 blue lines or 1 line to determine whether it's a positive or a negative result. It's great news because it's quick, and again, you don't need special equipment to develop it. And then with these tests, the thing about the antigen test, as we've talked about before, is that a positive test means it's very likely to be positive. But a negative test, we do see some false negatives with these antigen tests. So if we're highly suspicious that somebody has COVID-19 and they test negative using this test, we would need to do the backup test, the nasal swab. That takes a few more days to come back. But the good news is, again, is that if it's positive, it's positive. So we can give people some information right away and get them quarantined right away.
And the CDC posted new guidelines about who should be tested. Can you tell us more about those, and is there anything else that you'd like to add on that note?
Right. So this came out earlier this week, this slight change in the recommendations regarding who should get tested. And what changed was they said that if you've been in close contact within 6 feet of a person with COVID-19 for at least 15 minutes, but do not have symptoms, you do not necessarily need a test unless you are a vulnerable individual or you're in an area that requires it. So the thing about that is it's confusing because it's saying that you do not necessarily need a test. What exactly does that mean? In our mind, as clinicians, we believe that if you've been around somebody close contact who has tested positive for COVID-19 or who has the infection, you should get tested because we need that data. You might be asymptomatic. You might become an asymptomatic carrier and therefore would spread it within the community unknowingly. So in our recommendation, it's confusing, and we are sticking with the you should get tested if you've been exposed.
Yeah, talk about confusing. As you're sitting here, Ben and I are kind of shaking our heads trying to follow along with it. So
we're gonna go with what the good doctors are saying, Dr. Alexander.
Yeah,
so we'll follow your lead on that one. Is there anything else you'd like to add for us today?
Not anything except for what I said last week, and I'll just put the reminder out there. Get your flu shot. Again, it's not that we think that flu and COVID can happen to you at the same time, but certainly we don't want to decrease our resources, our hospital resources, and things like that if you get sick, if both are going on at the same time. So get your flu shots within the next month or two. September, October are the best months to get it, to keep at least that at bay.
All right, Dr. Alexander, we just can't say it enough. Thank you so much for fitting us into your schedule week after week after week and clarifying everything that's going on. I know, we appreciate it, and so do our viewers.